Question. A 45-year-old male presents to the emergency department with severe chest pain radiating to the left arm. He is diaphoretic, and his blood pressure is 160/100 mmHg. The initial ECG shows ST segment elevation in leads 2, 3, and AVF. What is the most appropriate initial management? A. Administer nitroglycerin. B. Perform urgent coronary angiography. C. Start intravenous beta blocker. D. Administer aspirin and clopidogrel. The correct answer is D. Administer aspirin and clopidogrel. This patient presents with symptoms and ECG findings suggestive of an acute myocardial infarction, MI, specifically an ST elevation myocardial infarction, STEMI, as indicated by the ST segment elevation in leads 2, 3, and AVF, which correspond to the inferior wall of the heart. In the management of an acute STEMI, the following steps are critical. Antiplatelet therapy. Aspirin and clopidogrel are antiplatelet medications that help prevent further clot formation. Aspirin irreversibly inhibits cyclooxygenase 1, leading to decreased thromboxane A2 production, which reduces platelet aggregation. Clopidogrel inhibits the ADP receptor on platelet cell membranes, further reducing platelet aggregation. Early administration of these medications is crucial in improving outcomes. Reperfusion therapy, urgent coronary angiography and subsequent percutaneous coronary intervention, PCI, or thrombolytic therapy are essential to restore blood flow to the affected myocardium. However, administering aspirin and clopidogrel is a key step before reperfusion therapy. Let's review the other options. A. Administer nitroglycerin. Nitroglycerin can help relieve chest pain by dilating coronary arteries and reducing myocardial oxygen demand. However, it is not the first step and should be used cautiously in inferior STEMI due to the risk of precipitating hypotension, especially if right ventricular involvement is present. B. Perform urgent coronary angiography. This is indeed a critical step in the management of STEMI, but before performing angiography, initial pharmacological management, including antiplatelet therapy, should be initiated. Angiography typically follows soon after these medications are given. C. Start intravenous beta blocker. Beta blockers can be beneficial in reducing myocardial oxygen demand and controlling arrhythmias. However, they are not the first-line treatment in the acute setting, especially if there are contraindications such as heart failure, bradycardia, or shock. In summary, the most appropriate initial management for a patient with an acute STEMI includes the administration of antiplatelet agents, specifically aspirin and clopidogrel, to prevent further clot formation and prepare for definitive reperfusion therapy.